Ever pondered the importance of a Pap smear or wondered what it entails? Well, buckle up because we're about to delve into this much discussed but often misunderstood medical routine. A Pap smear, named after its inventor, George Papanicolaou, is a procedure that involves collecting cells from the vagina and cervix, which is the lower, narrow end of the uterus. This procedure is typically conducted alongside a pelvic exam. The primary function of a Pap smear is to detect abnormal cell changes that could potentially lead to cancer, along with testing for precancers. Now, precancers are often caused by a very common sexually transmitted infection known as the human papillomavirus, or HPV for short. While there are countless strains of HPV, only particular ones are linked to cervical cancer. An HPV test, therefore, is designed to identify these high-risk, cancer-causing strains of HPV. This test can be carried out concurrently with a PAP test or performed on a PAP sample afterward in a lab. Before a Pap smear, there are a few things to avoid. Refrain from sexual intercourse, douching, or using tampons or other vaginal hygiene products 48 hours prior to your Pap test. These activities can interfere with the results, leading to false positives or negatives. If the results of your Pap smear come back normal, your healthcare provider will also evaluate the results of your HPV test, or recommend an HPV test on the same sample if it was not initially done. If both your Pap smear and HPV test results are normal, and you have no history of abnormal Pap smears or HPV tests, you probably won't need further testing or treatment until your next screening test, which is typically after 5 years for HPV testing or co-testing. However, if your Pap smear is normal, but your HPV test is positive, your healthcare provider will discuss with you the possible recommendations. This typically means that an HPV infection is present, but not causing any abnormalities in the cervical cells at the moment. Most HPV infections clear without causing abnormalities or cancer. An abnormal or unusual cell detection during your Pap smear is referred to as a positive result. However, this does not necessarily mean you have cervical cancer. There are several classifications used to describe abnormal Pap smear results, the most common of which is atypical squamous cells of undetermined significance, or ASCUS. This means that some cells from a Pap smear didn't look entirely normal but didn't meet the diagnostic criteria for an abnormal tissue area. ASCUS is neither cancer nor precancer, and may or may not ever lead to cancer. However, these changes require further investigation and monitoring. To wrap up, a Pap smear is a crucial medical procedure that plays a vital role in detecting precancerous changes and preventing cervical cancer. By understanding the process and its significance, you can take an active role in maintaining your health. Knowledge, after all, is the first step towards prevention.